Okay, so welcome back to our weekly dispensing lecture series focusing on supporting you to complete your portfolio of evidence. Today we are going to focus on the final learning activity. Remember, it is the final if you started with us from learning activity 1. I know some people are new today. Some of you started last week or with learning activity 3. So just make sure that you are able to complete the cycle from learning activity 1 up to learning activity 8. These sessions are recorded and we do share the link after every session to our YouTube, but also to our audio podcast, so that you can then go and review. So remember, it is a requirement that you must complete your reading, then do your portfolio of evidence. Once you submit a completed POE, you are then allowed to then do your summative assessment. And then once you have done that, you'll do your practical exam, and then that's it. You will then get your certificate of competency. So as I start, just to say that we are running this promotion for the next 2 months, which we started last week. If you know of people who are interested to study with us, bring them on board. And then you might get, discount yourself or even get a refund, to the proportion that you have paid for the course. Exciting stuff, ne? So yeah, for today, again, just to say you are welcomed to this session, and then we will cover the requirements for you to complete the course. Today, we are focusing on an audit of the drug supply management system. And then if we get time, you'll also give us feedback and specific issues you might want us to look at. Ms. Mamosagekana is the course coordinator. She's the contact person for all issues and challenges you might have around your studies. And I'm the instructor. I deal with the instruction and content. And we prefer that you contact us via this email so that most of the issues you raise can be addressed. Just remember, for you to complete the course, number one is that you need to go through the study units as outlined in the resource guide. So that's your step one, which is to go through the materials and read. Then you use your knowledge from the resource guide to then compile your portfolio by completing learning activities, which are included in the learner assessment guide. And then I will show you both documents, the learner assessment guide, which is basically your portfolio of evidence once you have completed it. The resource guide is the manual for the course. Step 3, then you submit your completed portfolio of evidence to the same email, support@aquatraining.com. You must include your affidavit, which confirms that you have done the work yourself. This affidavit is included in the learner assessment guide. Once we are happy with your work, you'll then get access to do the summative assessment. And then remember, in terms of the portfolio of evidence, always keep it close, keep a copy so that should we need some form of reference, you are able to provide it as such. To qualify for the certificate of competency, there's 3 requirements. Number 1, you must complete your portfolio of evidence as per the learner assessment guide. And then you must also submit and pass the summative assessment, which is a written multiple choice question. And then you must also pass the practical open book. And then once you have completed these 3 sub-bullets, you will then be certified to be competent. You will then get your certificate, which you then use to apply for the license with the Department of Health. Great stuff. So for today, we are focusing on an audit of the drug supply management system. Remember last week we dealt with a drug supply management system, but we were looking at SOPs, procedures that govern how work should be done so that the management of drugs can be done safely. So today we are looking at how do you establish that system, right? and the best ways for you to be able to audit, and then we'll take it from there. So in terms of your learner assessment guide, we are looking at learning activity number 8, which is found on page 42. And then in your resource guide, the theory which you are going to use to do this learning activity is centered around pages 190 and 220, which is study unit number 6 in your resource guide, right? So I'm going to pause there in terms of sharing, and then I'm going to share with you firstly the learner assessment guide. So when we say the learner assessment guide, when you start the course, you must have these 2 documents. You must have the learner assessment guide, and you must also have what we call the resource guide. The resource guide is the manual for the course, and then the learner assessment guide, that's how you are assessed by doing a series of activities which we call learning activities. These are 8 learning activities that you need to complete. And as I show you, you can see there are 8 learning activities. The first one was the need for you to evaluate prescriptions. So you got prescriptions that you needed to assess whether these prescriptions made sense or not. You are supposed to create the dispensing labels for some of the drugs that were prescribed in learning activity 1. Also developed prescription records for prescription 3, which is part of the, so these are building up. You know, if you look at learning activity 1, 2, and 3, these are the same learning activity. They are building up and looking at whether you are able to prescribe, create labels, and then prescription records. We then did the dispensing calculations, and then you developed a patient information leaflet. Then we did drug-drug interactions, and I introduced you to a platform where you can check the drugs and look at whether which drugs can be given together or not. Last week, we focused on the standard operating procedures, and by now you must have developed your SOP. If you are new, there's no problem. You will start with an audit. You'll read chapter 6, start with the audit, then go back, you know, and do the other learning activities. So it's not a train smash if you're joining us today. Remember, all the learning activities 1 up to 7, they're already recorded for you. They are on the link, which we will share later when we share the recordings for learning activity 8. So go through those learning activities and ensure that you complete each, you know, successfully. So that is very important. So today we are doing learning activity number 8, auditing of a drug supply management system, which you find on page 42. So when we go to page 42, there it is, learning activity 8, an audit of the drug supply management system. And we say if you do this learning activity and complete it, you must be able to manage medicine supply correctly. You should be able to distinguish areas where you are complying and areas where you are not complying, because it's only through audit that you are able to look at the quality gaps and then work through that. And then you also now need to demonstrate your understanding of the documentation required for an internal audit. So what is it that is needed, right? So to achieve competency, this is for now. So there you see already you are being referred to study units 2 and 6 from the resource guide. You are required to show that you are able to introduce necessary systems, right? So the thing is, if you're going to start your own clinic or work within a clinic where they are dispensing, you need to establish a system in stock management in accordance with the relevant acts and also quality, you know, standards. You need to show the understanding by commenting on whether an activity is carried out at your facility or not. So in other words, you're going to audit your facility or a pharmacy where you have access, assessing whether the things that are required by the laws and the quality regulators, are they in place or not? And obviously, if something is not in place, you need to then make a comment around the plan to put that in place. So there is a checklist which is provided for practice, and you would also use it now to establish once you are employed in a mine or in a private clinic and they say you are going to be a dispensing nurse, you would use this checklist now to establish, systems for safe control, management, and storage, of medicines, which is very important, right? So we will come back to this audit. Let's now go to the resource guide, which is the manual. And as you will see, remember we said study unit 2. So this is now study unit 2. If you remember, study unit 2 was about you knowing, drugs and how drugs work, and what stabilizes drugs, how to store medicines in a safe way, how to give drugs the correct route, what forms are drugs available, liquid, tablets, and so on, packaging of materials, So you have, for you to complete the audit, remember, you cannot audit something that you don't know. So how will you know if they have, or if what they're giving you meets the requirements for the quality standards? You won't know. So it's important that before you go and audit, you need to read chapter 2 or study unit 2 in your resource guide, and also read the final study unit in the resource guide, which is study unit number 6, medicine supply management. And this is the one we went through last week, where we said you have to establish a medicine supply system, right? Where you're going to focus on ensuring that there are standard operating procedures. And then firstly, does your facility have, procurement requirements? So when exactly do you order? How much is being ordered? How do you select the products and the suppliers, prices, and authorization? So managing of new stock, when you receive new stock, which is the one we did again last week, how do you receive it? Who verifies, and where is the data captured? And then who's responsible for labeling, the stock? And then once you have accepted the stock, how are you going to store it in terms of packaging and the legal requirements around receiving Schedule 6 medicines, which are prone to addiction and abuse? Then how do you ensure, what processes are you putting in place, procedures for monitoring and maintenance of stock, you see? So how do you issue stock, rotate stock so that your stock doesn't expire, and then maintaining the documents that must be retained as you receive, as you use, the drugs. Security is very important. Some drugs, people like them, they steal them, but even if it's not for illicit reasons, maybe they have someone who's sick, but remember, it's still a product that must be protected, and consumed with caution. Then stock taking, when do you do it? How do you do it? Maintenance and monitoring of storage conditions. So there's legal issues, there's the environmental control, because you don't want, for example, stuff that's supposed to be stored in a cold place, like vaccine, to be stored wrongly in a warm place. Or you find that you've got rodents that are eating your drugs, and then procedural control of stock. So how to handle returned goods, for example, how do you handle them? How do you avoid overstock? How do you ensure that your stock doesn't expire? But if it expires and it needs to be returned or destroyed, and it may, let's say, Schedule 6 drug has expired, how do you handle that? Which is quite important. So all these procedures, they are meant to create a system for handling and controlling your drugs, and to ensure that you abide by the laws that govern drugs and the quality standards, right? So when you say you are going to audit a management system, we mean you are going to audit Chapter 6. Now, you can't be going on to go and audit people when you don't know, So that's why you must go to Chapter 6 and go, page by page, and look at the procedures that need to be in place, and starting with stock procurement, as I have showed you, you read what, because here in the resource guide, you're going to get the standard. So what is expected, right? Once you have read and understand what is it that is expected, you then go to your learner assessment guide. And now I'm on the learner assessment guide. You go through the audit. You go and visit a pharmacy, or if you work in a clinic, you assess your own clinic, and you are auditing. So, when you audit something, you are asking questions that require whether something is in place or not. So, like you say, see the question here, in terms of the first procedure under manager, the drug supply management system, it's about procurement. So, are the items needed for stock investigated for, so are we investigating prescribing habits? Because that's where you can tell if there's some level of abuse. Do you do a needs analysis? Do you investigate pricing, quantity of the drugs and authorization? So you'll be asking a pharmacy or the facility you'll be visiting to say, does this facility have a list of quality? So who do they get the drugs from? And are these people credible people? And you need to have a list. It's like a supplier list, and then is a requisition or order compiled, is the order placed according to the SOP? So then you're asking them, do you have an SOP? Yes, they give it to you. Then you are assessing whether they are following the work based on the SOP, right? Remember, you must have done, in terms of last week's activity, an SOP on how to receive stock. So you'll be then auditing your pharmacy or that facility and saying, incoming orders, how are they checked? Who's checking them? Do they have an SOP that governs that? And are they adhering to that? Records of receiving activities properly stored. So where are the registers and documents, and who's keeping check of that? So you'll be going through all these questions under receiving of medicines. Do they have effective controls against theft? Do the records include the name and address of the person who supplied? Because the SOP is supposed to address all these questions. Now you are assessing whether they are implementing or managing their pharmacy work as per the SOP. Then you go to the SOP around monitoring and maintenance of stock. You do the same. You check, and then remember, if you say no, you must make a comment and say, so what's next? What is the proposed improvement? Even if it's a yes, but maybe it is an inadequate yes, there are still gaps that they need to address. You need to then make comments or suggestions on how to improve as necessary. So you'll do it for maintenance of documentation, security, stock taking procedures. As you can see, these topics, they are aligned to chapter 6 or study unit 6 in your resource guide, monitoring and maintenance, handling of returned goods. And you can see, as soon as you do that, you are done with your and then you can even calculate the yeses, and then you make your comments, because you need to give them the total points for each section. So if they got 2 yeses, you put a 2 there, and then you need to make suggestions as you go by it, right? So in the next 7 days, that is the task at hand. You need to identify a facility, a pharmacy, where you need to ask them that you are doing your dispensing studies, and you would love to audit them, and it will also help them to understand, where they are in terms of their quality system. At the end, you give them feedback, but it is also a learning activity from your side. Right. That's it for this week. And I hope that it's a very simple one compared to the other learning activities that we have done. But yeah, thank you very much for joining us. And I hope to see your POEs as of next week. I'll be receiving them by God's grace.